Well, good afternoon and welcome to South Australia's daily COVID-19 update. I'm joined for this press conference by the Honourable Stephen Wade, the Minister for Health and Wellbeing, Professor Nicola Spurrier, our Chief Public Health Officer, and Commissioner Grant Stevens, who's also the State Coordinator during this major emergency declaration. Well, the good news is that the internal restrictions that were placed in last week will be coming off as of today, as of this press conference, and we will also be lifting the restrictions on people coming in from Victoria. So two important announcements today. The restrictions put in place last week will be coming off, and we will be opening up to Victoria without the restrictions that have been placed for the last couple of weeks. I want to sincerely thank all South Australians for the way that they've worked with these new restrictions that we put in place last week when we saw the escalating numbers of the Delta variant right across the country. And they were necessary restrictions because we did have very, very low level restrictions in South Australia, as you are all aware, and we weren't wanting to take any chances with the escalating numbers right across the country. I really want to thank South Australians who have gone and got themselves tested. In fact, yesterday was a near record, 9,495 on a Sunday. And it just shows the level of commitment from the people of South Australia to make sure that we keep our state safe and our economy strong. So sincere congratulations to everyone. So just the following changes. Hospitality and other businesses will revert to 3 per 4 square metres. The strong advice to wear masks on public transport and in indoor spaces will be lifted. Limits for home gatherings will go back to 200 people, noting that organisers must have a COVID safe plan, a COVID marshal and a QR check-in for those types of numbers. Dancing and singing can return. And drinking while standing up is also back. So that's all very important. The testing requirements for those people that are travelling from Victoria will be lifted. The Transition Committee will meet again this Thursday to look at the borders, particularly with Western Australia, the Northern Territory and Queensland. So there will be a further meeting on Thursday, but no changes to those border arrangements. But we are very pleased with the way that the situation is moving in terms of Western Australia, Northern Territory. A couple of new cases today in Queensland, so we'll have more to advise then. And of course, we see the numbers in New South Wales still fairly worryingly high, so certainly no changes in New South Wales this week. Can I also just let you know that SA Health is working with the Stadium Management Authority for the Clash, the very important game which is on at the Adelaide Oval on Thursday night. I think everyone knows who I'll be going for in that clash. So I'm very hopeful that we'll be able to get an agreement for a match at the Adelaide Oval this Thursday night. I would also just like to say that I have spoken to the family, the Miners family, over the weekend. They're in extraordinarily good spirits. And again, I just wanted to convey my grateful thanks on behalf of all the people in South Australia for the great work that they had done. They were very modest. They said, look, that's what anybody would do. Look, the reality is, if they had have got their test on Saturday morning, it came back negative, and they'd gone out into the public and they'd ignored the restrictions that were in place, and they'd gone to see a movie or maybe go to the footy or a shopping centre, we could have been in a very, very different situation in South Australia. So I'm extraordinarily grateful to them. They're in good spirits, the parents, the 4 children, so it was great to have a chance to have a chat with them. Again, my strong message to the people of South Australia is just very, very clear. If you're feeling unwell, go and have a test. Isolate yourself from your workforce. It's just not worth taking the risk, especially at this point in time. Make sure that you are continuing to use the QR code scanner when you go into a business or a venue which is displaying that QR code. And thirdly, when it is your turn, when you are eligible to have that vaccination, please get it done, because that is going to be what keeps yourself, your family, your workplace, our community, our whole state safe and our economy strong. So I'll answer some immediate questions now, and then I'll pass over to Professor Nicola Spurrier, and then ultimately to our State Coordinator, because he will have to officially say that the restrictions are lifted verbally so that they come into place.
What was it when it came to the borders with WA and Queensland that you said, no, not now, not yet?
So I had a chat with the team this morning. The reality is that whilst they have done very well, we don't have access to all of the information that they've got. We're just wanting to wait those extra couple of days. We've done so well in South Australia. We have more people employed now than before the pandemic, so we're not looking to take any chances. So a couple of extra days there. The Transition Committee will be meeting on Thursday, and I'm hoping that we'll be able to lift that border restriction, certainly with Western Australia, Northern Territory, provided there's no further deterioration in the conditions there.
Does the changes to the Victorian rules apply across the board? It's not just you don't need to be tested. Is it also some of the issues to do with not being able to attend high-risk sites or medical centres? Are those rules no longer apply?
That's right. So we do have a situation where when we are having a graduated return, that we do require people not to go into areas which are at high risk. So, for example, an event over 1,000 people or into an aged care facility. So we have that graduated return. What we're saying today is that those testing requirements for people coming over from Victoria will be lifted as of this press conference.
Has there not been a way so far that South Australia can separate out the ACT and New South Wales? I know we've spoken about the porous border, but people from the ACT can go to New Zealand and they can't come here.
Yeah, look, we've looked at this very carefully. We know that it's hugely inconvenient for people that are living in Canberra, but my understanding is there are more than 10,000 people from Sydney currently in the ACT who are in quarantine. So, look, it is a dangerous situation. I think we have an update today from New South Wales, another 35 cases. We're now up to a total of 465 exposure sites in New South Wales, and so we know that this Delta variant is extremely transmissible, and we're just not wanting to take chances at this point in time. Now, we'll continue to look at it. We'll continue to look at the ACT. They have defied the odds for a long period of time in terms of not getting the new infections there, but it is difficult to understand how that could occur because it is just such a porous border, and we are seeing new cases in New South Wales every day.
They have to return a negative test result before they go to New Zealand. Would that be something we could consider here?
Look, everything's worth considering, but the PCR test is a point-in-time test. Don't forget, the miner had a PCR test on Saturday, and he was not infected. In fact, he probably was infected that time, he just wasn't showing the symptoms because the incubation period is up to 14 days. That's why we do have these strict rules in place.
Premier, could I just ask you, the Transition Committee met late yesterday, meeting that was finished around 4:30, 5 o'clock, yet you're only announcing nearly 24 hours later that these restrictions are being eased. Why was there been a delay in publicly announcing something that is so important to so many different people? Again,
there was a huge number of tests yesterday, 9,000 or nearly 10,000 tests yesterday. We wanted to get those tests in, get those results in the Transition Committee to have one last look at all of the information that had been provided from other jurisdictions before we made the announcement. So, look, we think people will be very pleased with this. We said we didn't want to keep the restrictions in for one day longer than we needed to. Last Monday we said that we thought that it would take around about a week. We got that information in overnight and some information in from other jurisdictions today. It was pretty much in line with what the thinking was yesterday, and so there was no reason to delay it any further. We're very pleased to announce that those restrictions that were put in last Monday will be removed effective immediately.
Can I just, as a follow-up to that, given the fact that we have had only the miner and his family being deemed so-called community transmission here in South Australia, what do you say to people that believe that your government and your officials overreacted in imposing these restrictions on people given the levels of community transmission that we had here in South Australia?
Look, I think the one thing about this pandemic is everybody's got an opinion, and we have to, as a government, form our opinion on who we should be listening to the most. And so we listen to the experts, and that's what we've done since day one. We've listened to the experts, we've listened to science, we've listened to the evidence, and that has framed our response. And I think it's held South Australia in really good stead. I can't think of many places around the world that have the level of restrictions that we have at the moment without, a very, very high transmission rate still. So South Australia, we're doing extraordinarily well, but we can't become complacent. But our advice comes from the experts.
Premier, we've had several hundred young South Australians opt to get the AstraZeneca vaccine in the last week.
Yes.
What's your message to them?
Well, I think it's about choice. So some people want to look at the risk associated, the very small increased risk of TTS from the AstraZeneca for those under the age of 60. They weigh that up against the risk that they perceive in terms if there was a more substantial outbreak. And I think there are reasonably small risks on both sides, but some people will form the opinion after consultation with their medical practitioner that that risk is worth taking. And I think that's what we're offering. Informed choice. It's supported by the Royal Australian College of General Practitioners. It's supported by the AMA. Now, there would be members within both the RACGP and the AMA who disagree, but essentially what we're doing is providing people with choice.
Good to see them being proactive and getting out there and helping with the vaccination regime.
Look, we don't promote that this is what they should be doing. We're just saying this is now an option. We know that there were many younger people who were not eligible for vaccines that were saying, look, if the AstraZeneca was available to me, I would have it. Now, that wasn't an option until the changes that were made following the National Cabinet meeting last week. So that has now been put in place. It is an option for people, but they need to have that discussion with their medical practitioner and form their own opinion. Informed consent is extraordinarily important in this instance.
Are you looking at opening up a vaccination clinic in the western suburbs? The opposition has been out today saying that we should reopen the one that's at the Queen Elizabeth Hospital. Is that an option?
Well, there wasn't a vaccination clinic there. There was a testing place or station in the western suburbs. Look, we take our advice from SA Health. I spoke to SA Health. I spoke to Professor Nicola Spurrier about this last week. She may choose to update, but at the moment we believe that there are enough places within GP clinics in the western suburbs, as well as the 3 mass vaccination clinics across Adelaide. As you would know, we opened up a new mass vaccination clinic today down at Victor Harbour. We've got 2 other country-based mass vaccination clinics to open up later this month. Firstly in Mount Barker and then subsequently in Gawler. So that will take 4. That will take it to 4 mass vaccination clinics in the country, because we already had one down at Mount Gambier. And we're always looking for new ways to get people vaccinated. And if there is a need for it in parts of the city, then we'll definitely look at that.
It's clearly signed as a vaccination clinic. There are signs to wait in line. The room is all decked out. It says COVID-19 vaccination clinic. So is it being set up? Or?
Well, I'll perhaps, when I've finished, I'll ask Professor Spurrier, because she might know more about that, or maybe Stephen Wade. Any other questions for me?
A different topic.
Yes.
At the start of NAIDOC week, we've
Yes.
seen a few stickers, some racist stickers pop up in Adelaide CBD. Have you heard about this? And do you have any reaction to this thing happening?
Look, South Australia has historically been an extraordinarily tolerant and harmonious place to live. Especially in NAIDOC week, we're asking people to be very, very mindful. These these racist stickers have no place in Adelaide whatsoever.
Premier, can I just ask you on vaccination levels?
Yes.
Obviously, you had a National Cabinet meeting last week in which a 4-phase plan was announced, but there were no benchmarks in terms of vaccination levels or what levels we can get to and expect to not be locked down anymore. What would you like to see going forward, and what's the plan for us to avoid restrictions and lockdowns in the coming weeks and months?
So South Australia was very, very pleased to support National Cabinet on Friday last week with the 4-phase approach, a pathway, if you like, out of the situation that we find ourselves in at the moment. I think South Australia at the moment is the envy of the world, but we are very isolated from the rest of the world, and we need to track that pathway. The way that we track that pathway is through higher vaccination levels right across the country. So we've got agreement at the National Cabinet level. We now need to look at what those thresholds from moving from one stage to the next are going to be. That's on the agenda for the next National Cabinet meeting.
Would you like to see more aged care workers vaccinated? There's federal government data that shows only 16% of South Australia's aged care force is fully vaccinated.
Look, we believe that this is now a priority. We've looked at some ways to try to stimulate and make it more convenient for aged care workers to get themselves vaccinated. We know that they look after a very vulnerable community here in South Australia. We know that they do a great job, but we would like to see those vaccination rates go much higher.
What are those things you're considering to make it easier?
So one of the things that we did was to change the opening times for some of the mass vaccination clinics, just to make it easier, because a lot of people who work in this sector might be working during the week and find it more difficult to get along. So we've opened up on Thursday nights, and we're trying to look at different ways to get the aged care workforce in to get their vaccinations as quickly as possible.
And particularly with what's happening in New South Wales at the moment, is that now an even bigger priority?
Look, it's absolutely a very, very important priority now to get aged care workers vaccinated. They look after a very important segment, a very vulnerable segment of our community. It's really important that the workers there are doing everything they can to protect themselves and ultimately their residents.
Some people are saying in certain areas it can be quite hard to get to one of those mass vaccination clinics. Public transport isn't really a good enough option when they're having to change on 3 or 4 buses,
Yeah.
trains. So are you looking at maybe branching out into smaller hubs?
So we've got multiple different ways that we're increasing the way that people can get vaccinated. Part of it is our own mass vaccination hubs, but in addition to that, the GP network. Now, we have got very, very good coverage. Nobody should be too far at all from a local GP who can perform that vaccination. Now, we're in certain very remote parts of the state where we have had problems with distance from a vaccination clinic. We've been working with the Royal Flying Doctor Service to make sure that we can even get to the most remote parts of the state. This is really, really important. We want every single person that is eligible in the state to have a very convenient way to get that vaccination. Now, at the moment, demand and supply are almost in balance here in South Australia. As more supply becomes available, we increase the available appointments. You would have seen that as of late last week, another 2,000 Pfizer appointments became available just at the Wayville mass vaccination clinic. Now, as those supplies increase going forward, and we know the federal government's done some excellent work procuring more of the Pfizer dose, and then subsequent to that, we will have access to the Moderna mRNA dose. So when they come online, there'll be further opportunities for us to increase the availability of those appointments right across the state.
And have we got a personal target in South Australia of what we want to reach?
Well, I've said repeatedly that I would like to have every single person who is eligible to have that vaccination, because that will be ultimately the best pathway for us to completely open up our economy as quickly as possible. Now, it's going to take some time, mainly because in Australia we do not make it mandatory. But I think as we go further along the track, people who had some hesitancy with regards to the vaccine are now thinking more positively about it. With these types of programs, you always get the early adopters, and then you have other people that say, I'll just wait to see what is happening. Well, now they're hearing from people who have been to their GP or maybe to one of the mass vaccination clinics, and they've had very positive responses. I speak to people every time I go down to our mass vaccination clinic at Wayville, or maybe down at Noarlunga or out at Elizabeth, and I'm always very pleasantly surprised that people are saying it was easy, it was very streamlined, everyone was very courteous, we got excellent information, and it didn't hurt a bit. So I think as those stories get out, we'll find some of those people who were maybe a bit anxious about it, a little bit hesitant about it, they'll be coming forward. And that's essentially what we're seeing at the moment. So the hesitancy is reducing. People are rolling up to the mass vaccination clinics. They're rolling up their sleeve. They're having that vaccination. It's safe, it's effective, it's free of charge. It isn't mandatory, but it's really important to get it done.
But no exact target?
No, not at this stage. I'm going to pass over to Professor Nicola Spurrier, then we also will need to hear from Grant Stevens today.
Thank you very much, Premier, and good morning. Good afternoon, I should say. So thank you very much for coming to the COVID update. I'll just do a little clinical update and then I'll talk a little bit about lifting the restrictions today. So we have one new case today. This is a child in a Medi hotel, so it's not related to the Miners family, but it is another case. We've got currently 16 active cases. We do have 2 people hospitalised, so COVID is always, in some people, quite a severe disease. A man in his 60s and a man in his 20s, both fortunately are in a stable condition. And as the Premier said, we had nearly 9,500 COVID tests done yesterday, which is great. So just a little bit more background as to why we, from a health perspective, provided advice about lifting the local restrictions in South Australia, lifting any of the requirements for people coming from Victoria, but just holding out a little bit longer for WA and NT. So it's always a bit of a way up between what we're doing in our own state and what's happening in another state as to making those decisions about the border. And as people appreciate, we did have a problem here ourselves last week, which require a lot of work from our contact tracing team combined with SAPOL. And along with everybody in South Australia, including the family involved, we got on top of that very quickly. And the other thing to take into account was that we, when we closed the border to New South Wales, we still had some people that had come into South Australia over a rather concerning period of time or window of time. And now that time has passed, and I think if we were to have seen any problems related to that, they should have eventuated by now. So on the basis of that and what we're doing in our own state, I felt quite comfortable about lifting the restrictions here. But it does mean that we still need to be very mindful that COVID is in Australia. If you've got any symptoms at all, to get tested. We will not be putting out the strong wording around wearing masks. However, if you haven't been vaccinated, and I've been vaccinated, I feel like I've got an invisible mask because of my vaccination, particularly if you're not vaccinated and you're an older person or otherwise you know, concerned about COVID, then there's nothing wrong at all with wearing a mask. And I certainly wouldn't say to anybody, don't wear the mask. There's no problems at all continuing to wear it. So then the other thing is our requirement in our aged care and hospitals about needing to wear masks will also lift. But again, some hospitals and some parts of hospitals may require you to wear a mask because of the vulnerability of their people that they're looking after. So just please follow the instructions of those organisations, and that's they can put their own policies in place if need be. Then if we look at Northern Territory and WA, because they had only a small number of cases and they have got on top of their contact tracing very quickly, again, that's very reassuring for us. However, both states or both jurisdictions have still got quite significant restrictions in place because there were some public exposure sites associated with those cases. So I felt if we were going to lift our internal restrictions, then it would be safer to just spend a little bit of time, a little bit more time out from when those public exposure sites had been a problem in both of those states. And then, of course, looking to see how Queensland goes, and everybody is hoping around Australia that things in New South Wales continue to remain good, and we'll hopefully in the next couple of days start to see some reduction in those cases. So if you think about the whole of Australia, we seem to have, it's quite evident we've got a reducing risk, still quite a significant risk on those eastern states though at the moment.
So the chances of any changes with Queensland and New South Wales in particular, even at a meeting on Thursday, seem unlikely?
Look, it's a bit hard to make a comment at just this point in time as we look at things over the days and we get that detailed information. It may be possible to look at parts of Queensland, but just at the moment we're just going to stay put.
Professor, on radio this morning you said that South Australia seems to have dodged a bullet. Can I get your thoughts on that, and what do you believe that the restrictions and the levels that, and I appreciate what you've just explained, do you believe that it was the right decision to impose the restrictions on South Australia and it was an overreaction?
Oh, I definitely would say it was the right decision, and that was, you know, the advice I was providing. We have to be responsive to the situation, and the modelling that I've been shown is if you have the Delta variant and it gets into your community, then it is very, very difficult to get rid of it and you need quite prolonged lockdowns. So what we did was put some light touch restrictions in place, and I know that it has had an impact on businesses, but the worst would have been if we did have a number of cases here and we couldn't get on top of it quickly, and we would have ended up with a lockdown. And this is what's actually called the prevention paradox in public health, because we're trying to prevent something happen. So you often have to put things into place in a precautionary way. Nothing happens and then people will say that you've overreacted. So that's something that happens to us all the time in public health, but I think it was really critical last week that we took those we put those restrictions in place.
So are we saying it's likely we could open the border to WA and Northern Territory on Thursday?
So the Transition Committee's meeting on Thursday, and then we'd be reviewing it and looking at a decision for the coming days.
And does this mean after we've opened to Victoria as well, it used to be 14 days of no community transmission or no cases in the community. Have we gotten rid of that edict? Has it changed now?
No, it actually depends on the situation that you've got. If you've had widespread community transmission and the jurisdictions had to lock down to, as it were, try and burn out some of those chains of transmission that may not have been obvious to the contact tracers, then we do need to have that 14 days. However, if you've had small outbreaks, as has Northern Territory and WA, where they've found out about it really early on, so there hasn't been time for any chains of transmission, then you can take a different approach, a more nuanced approach. So it's really horses for courses, looking at the information and then coming up with something that's reasonable.
And is Queensland on a different scale to WA and the Northern Territory because of the community transmission there? Would we be waiting 14 days for Queensland?
Look, I think people, if they're following the news and the information from Queensland, they have had quite a number of different separate outbreaks. Now, they are working very hard to link all of those cases, so it will depend on how they go with that linking and whether they think there are any transmission chains that haven't been identified.
Professor, can I just follow up on Andrew's question about dodging a bullet here in SA? Do you think that's because of the good work of the family and the contact tracers to put a ring around this quickly?
Oh, absolutely. I mean, this family did absolutely the right thing. They followed all of the instructions, but also the whole of South Australia's done a great thing. They've come out, they've got tested, they've made me feel reassured that we haven't got cases here. And of course, I'm very proud of the contact tracing team and the work they've done with SAPOL, getting everybody notified, getting all the testing done, and big thank you to SA Pathology, ClinPath and ACL.
Professor, can I just get your views on AstraZeneca, if I may? Obviously, there's been a flood of young people aged under 40 that have come forward and got the AstraZeneca. What do you say to people who might be in that younger cohort about seeking AstraZeneca, and do you feel that it is safe for them to do so?
So we're very mindful here in SA Health to be following the ATAGI advice, and the ATAGI advice is very clear that Pfizer is the preferred vaccine for anybody under 60. So we'll continue to provide that advice. However, there are some people that may want to get vaccinated earlier. As the Premier said, they are able to. The ATAGI and TGA never banned AstraZeneca for younger people, but they have facilitated that access through general practitioners. And it really is important that if somebody's thinking of having that vaccine, they're in that younger age category, that they have a really detailed conversation with their GP so that they understand the risks.
And you were saying
you said that extended lockdowns are necessary to stop the spread of the Delta variant. Under that logic, does it look like the lockdown in New South Wales will probably continue in for a while?
Oh, I can't really make any comments about the New South Wales lockdown. It would be totally inappropriate of me. The other thing is, as we go forward, we'll have more people vaccinated in our community, and so you do need to nuance this with where you are at. It's quite complicated, and you have to take all of these data points into account.
Professor, you've said that you would like 80% of the population vaccinated by October. That's still a number of months away. What levels would you like to see in the community over the coming weeks and months for you to be confident that you don't have to recommend or provide health advice for new restrictions or, at worst case, a lockdown?
Look, I know that people are very keen to get an exact number, and really to give you my exact quote is that I would like to see at least 80% of South Australians vaccinated, because I know that it is the best way to protect both individuals and our community and see a way out of this pandemic. So I can't give you exact numbers because we're getting new information all the time about how effective the vaccine is in terms of its impact on people's own health, but most importantly about transmission transmission and actually stopping people getting infected. And in fact, the outbreak in New South Wales has given us a little bit more information, because there have been a number of people who have been vaccinated and have come in contact with the virus. So I think we'll have some interesting information coming out of that outbreak. I know it's been very hard, and I wouldn't have had the outbreak just for this, but we will learn more about our own experience with the vaccines here in Australia.
Can I
Professor,
please
if
ask
we
you
were
on
going to get a-
vaccines, do we need, what's happening with that Western Suburbs?
Yeah, so I did follow that up because I had a conversation with a number of residents there, and SA Health has looked closely at that. In fact, there are a large number of GPs in that area who can provide vaccines, and actually from today, GPs in South Australia are going to be able to start to use Pfizer as well, so that we can get it more complete coverage. My understanding is that there'll be over 100 GPs eventually who can use Pfizer, and we're just starting that off this week.
And there is a clinic, or there is something that looks like a clinic, it's very clearly labelled COVID-19 vaccination clinic on level 7 at the QEH.
So we did have a vaccination clinic there for our staff for a period of time, and I presume that's what the signage is still there remaining.
Could it be stepped up again, reopened?
You wouldn't normally want to set a mass vaccination clinic up perhaps in that part of the hospital. I mean, I'm not involved with that hospital, but there may be other ways of doing it. But I think the signage that is there is probably relates to the previous clinic that was used for staff.
So are you confident that the GPs in that area will be able to provide enough of a vaccination, and we don't need a clinic in that area, given they were quite low on the heat map last week?
Yeah, we'll just definitely keep watching the space, and if we feel that the vaccine rates are low, then obviously we'd be looking at that and other parts of the state. There's potentially other parts of the state that have low rates as well, so I think we just need to keep looking at it over time as we get more GPs on board with both the AstraZeneca and the Pfizer. Let's just see what the numbers look like.
Professor, can I ask you about the child who tested positive last 24 hours? Is that child doing okay? Do we know how old that child is?
I don't have the exact age. I think it's less than 10, and they are doing quite well, and they are linked to a couple of other people at Tom's Court, so I presume it's one of a close family member.
Professor, if we were to get a serious outbreak in South Australia, like what's happening in New South Wales and Queensland, where would those cases go if Tom's Court Hotel was full, and how many days would it take to make those other facilities available?
At the moment we have not got an outbreak, and in fact when we had our initial wave we were able to manage quite well having our cases into the Royal Adelaide. We're very lucky with the Royal Adelaide Hospital because it was built, it's a new build, and its infectious disease wards are in a different wing. So in terms of infection control, it is a really good setting. Our plan had always been to have dedicated COVID hospitals, and that's really from an infection control perspective. So we do have plans, obviously, if we have large numbers of patients with COVID-19, but it wouldn't be sort of opening up another Medi hotel.
And how quickly would that happen? Would they just go straight to the hospital? Is that correct?
There's ways of triaging and planning ahead, and I don't have any concerns that we wouldn't be able to do that.
Commissioner, can we have a word, please? Thank you very much, Professor.
You sound like an angry parent. Can we have a word?
Oh, I don't mean to be like that.
Just before you tell me off then, this is a formality that has to occur because the Transition Committee decision yesterday was that the restrictions for public activities would be lifted as of 1 minute past midnight on Tuesday morning, so another 12 hours or so. But based on the advice from Professor Spurrier this morning and the testing results from yesterday, we made the decision that there was no reasonable barrier to lifting those restrictions immediately. So effective immediately, the public activities direction that is currently in force is going to be superseded by a new direction which will take us back to exactly where we were prior to Monday last week. So we are back to what is our current level of normality, and I think the Premier did a very good job of explaining all of those steps. But this is simply a formality that means this verbal direction allows that to occur. So restaurants, cafes, hotels can increase their patronage now to 3 people per 4 square metres. All the other caps are gone, back to where they were before. Businesses and venues that have a COVID safe plan will receive an email shortly with an updated COVID safe plan, which will have the new calculation for their area and how they apply that for the number of people they can have on their premises.
So the Transition Committee meeting yesterday, can I, 2-point question. Did the Transition Committee meet today?
No, there was no meeting today. We had a meeting late yesterday. The decisions were made, and it was simply waiting for those final results from yesterday's testing. So we were ready to move and provide these announcements today.
And that is why the announcement wasn't made yesterday, because there is some criticism in the community that the decisions were made late yesterday, 4:30, 5 o'clock, and yet nearly 24 hours later you're coming out and saying immediately they can be lifted. Is that the reason why you didn't make any announcements about the changes to restrictions late yesterday?
I think I was pretty clear about that. The decision was that we were going to lift at 1 minute past midnight on Tuesday, but because of the results and the advice we received this morning, not through Transition Committee, but simply through communications with SA Health, I made the call that we could do it immediately, and that was agreed to by SA Health as well. So we're not waiting another 12 hours now. We're moving as quickly as we can to lift those restrictions, and the good news is it's less than 7 days in total.
What was the compliance like during that time of the restrictions? Did people increase QR codes, that sort of thing, during that time?
Certainly. Businesses generally across the board, from our observations, did the right thing, and we've always said right throughout the course of our COVID response that by and large the community as a whole have done an exceptional job in doing their best to comply with these instructions as they come out. We saw that again this time. One thing that we do notice when we do put restrictions in place is that we do often get increased calls to our 131 444 number or 000 with complaints of non-compliance, and we didn't see any particular spikes in that regard. So I take that as a good sign. And just simply from being out and about in the community, we saw that there was a suppressed level of activity in those places that were required to make those changes.
Can I ask about the border with WA? It's a very big border, but we've heard stories of people being allowed to come in and get all the way to Adelaide without being stopped or checked. Is that what's the case there for people travelling from WA?
I don't have any specific information about that. Permitted travellers are still allowed to come through from Western Australia into South Australia. It is a big border, but there are very few legitimate crossing points as well. So from a resourcing point of view, it's not terribly onerous, but I don't have specific information about people getting all the way to Adelaide without being stopped.
Would you be surprised to hear that? That we've spoken to a woman who has made it here, and she rang up a couple of times and got conflicting information about whether or not she was allowed here, and she got to Adelaide and then was told, no, you're okay, you don't have to quarantine.
No, I can't comment on hypotheticals. I don't know whether that's occurred or not.
But would you be surprised to hear that people are getting here from Perth without being stopped by anyone?
Generally speaking, yes, depending on when the people come through. Yeah, I think it's important to acknowledge that when we make a decision to stand up a border, particularly in somewhere as remote as the Western Australia-South Australia border, it does take a little bit of time to get the resources there, so people may have come through during that window, but I don't have any specific information about breaches like that.
Commissioner, we asked the Professor and the Premier about borders. Can I get your thoughts and your views on borders and what may or may not occur later in the week?
Well, things are looking good for Northern Territory and WA, and as Professor Spurrier said, we're just waiting for that final piece of information or validation that the concerns that were apparent in those two jurisdictions are no longer there. We'll assess that information over the course of the next few days. We'll be formally meeting as a transition committee on Thursday, and we'll make a determination as to whether we can lift those border restrictions or change those restrictions for Northern Territory and WA. Obviously, we're still watching New South Wales and Queensland quite closely, and we'll see what happens with that.
And over the past week, Professor and others have said we've seemed to have dodged a bullet. Are you comfortable in the restrictions that you imposed on the community a week ago, and do you think that it has been effective in the goal that you were trying to achieve?
I think it's worth explaining that. Yeah, I agree, we dodged a bullet. The reality was, at the time of imposing those restrictions back last Monday, we were not aware of any positive cases in the South Australian community, but what we were very concerned about was the level of transmission in other places around Australia. So the restrictions that we put in place was to suppress some activity in South Australia on the basis that we are the most relaxed state when it comes to COVID restrictions, and if we did find that someone from New South Wales or Queensland or any other place found their way into SA and were positive, that we may have a significant issue on our hands in terms of being able to contain that virus within our community. So it was the reminder about testing, it was the reminder about QR codes, and just taking some steps to slow things down a little bit until we were confident that we had our borders in place, that there was no unnecessary risk associated with people transmitting the virus from another state or territory into South Australia. So I think it was the right call. And as it turns out, we did have a person enter South Australia who tested positive. Obviously, that person's family also tested positive, and we weren't aware of that at the time that we made these changes. But I think it validated those changes as being necessary. And as has been said today, I think we're very lucky that those people did the right thing and complied with the instructions they were given.
Given the
Last
size
question,
of Queensland, would you consider targeted changes in border restrictions for Queensland? Because obviously local factors are vastly different in different places. Is that something you might entertain sooner than a whole of state dropping the border?
That's part of our consideration, is whether or not we can restrict the level of restrictions to certain local government areas, or whether it's necessary to maintain a state-based approach. So that's part of our conversation.
Can I ask you about the racist stickers popping up around the CBD? Is that a crime that they've done, and your reaction to it happening at the start of NAIDOC week?
Look, clearly, I don't think anyone could support that or not be offended by anything that has a racist overtone. I'm not specifically aware of them at the moment, but we'll certainly have a look at that. And I couldn't comment at the moment whether or not that constitutes an offence.
What about your reaction to something like that happening at the start of NAIDOC week?
Oh, I think it's quite offensive. I think it was said by the Premier that South Australia is a multicultural, inclusive state. We pride ourselves on, respect and appropriate behaviours, and to see this sort of thing appear, if it's as you describe it, then it's very inappropriate, offensive, and I think it undermines the general attitude of most people in South Australia in terms of their inclusiveness.
The Lord Mayor has said she wants these people found, and she wants the highest fine or whatever it is that implemented. Are there laws against hate speech?
Well, certainly there are offences committed for offensive behaviour would be one thing. There would be a range of things that may be considered, but I don't have the specifics. I haven't seen the stickers and I haven't heard about it. Thanks.
Thank you very much.
Can we have a